What if I told you that some of the things you already have in your medicine cabinet or even your pantry could play a real role in your prostate cancer care? That's exactly what we're digging into today. We're going to unlock some fascinating research that looks at how simple, everyday choices might just support you on your journey. So let's jump right in.
So, could your daily habits really support your cancer treatment? It's a huge question, right? And it's exactly what we're talking about. Because, there's this growing mountain of evidence that suggests, yeah, some dietary choices, even some over-the-counter stuff, can actually make a difference. Okay, so we're looking beyond the standard treatments here. We're exploring what else is out there, these complementary approaches. And what we're about to do is connect a few things you probably have lying around the house to some absolutely remarkable clinical data.
And the whole point of this is super simple. It's to arm you with credible, solid, research-backed info. This is not, and I repeat, not about replacing your doctor's advice. It's all about making your next conversation with them that much richer and more informed.
So just to be crystal clear, and this is important, this is not medical advice. Our job here is to connect you with the science, so you can walk into that oncologist's office as an active, engaged partner in your own care. That's the goal. All right, let's kick things off. Our first stop is something I'd bet you have in your house right now, aspirin. Yep, that common painkiller. Turns out it might just be a bit of an unsung hero when it comes to prostate cancer care. So, check this out. A recent study looked at a group of patients who'd all had surgery, a prostatectomy, and what they found was pretty amazing. Taking just a low-dose aspirin was linked to a 36% drop in the risk of the cancer coming back. I mean, that's a huge number.
But hold on, it gets even more dramatic. They looked specifically at patients with the more aggressive forms of the disease, and for them, the study found that aspirin slashed the relative risk of recurrence by about 55%. 55%! That is just incredible. And you don't have to take my word for it. You can see the data right here. Look at this graph. Over 3 years, that top line is the aspirin group. 85% of them were recurrence-free. The bottom line is the control group, just under 75%. You see how that gap between the two lines just keeps getting wider? That's not just a line on a chart. That represents a real, significant difference in people's lives.
And the story doesn't even stop there. The potential benefits go beyond just surgery. Other research has shown that for patients who had radiotherapy, aspirin was linked to a 60% lower rate of the cancer spreading. And get this, one really big analysis even found that taking aspirin literally halved the risk of death from any cause. It's pretty powerful stuff. Okay, moving on from the medicine cabinet to the kitchen. Let's talk about something many of us can't live without, coffee. But this is where things get really fascinating, because the benefit you get from that morning cup, well, it's totally personal. It all boils down to your DNA. So there's this one specific gene called CYP1A2. The easiest way to think about it is like a switch that controls how fast your body processes caffeine. You're either a fast metabolizer, meaning you burn through it quickly, or a slow one. And it's pretty much a 50-50 split in the population. And this is the really critical part. Depending on which switch you have, the same cup of coffee can have the opposite effect. For the fast metabolizers, having up to 3 cups a day was actually linked to a lower risk of the disease progressing. But for the slow metabolizers, drinking more coffee seemed to be associated with an increased risk. It's a perfect, real-world example of just how personalized nutrition can be. So now you're probably wondering, well, which one am I? And the cool thing is, you don't have to guess. There are a bunch of home DNA test kits out there now that can literally tell you if you're a fast or slow caffeine metabolizer. All right, for our last example, we're heading back to the pantry. We're going to talk about walnuts. And this is such a great story because it shows how a simple food can go on this incredible journey all the way to a major clinical trial. So 34%. What's that number? Well, one big study, we're talking over 6,800 patients, found that those with localized prostate cancer who ate nuts more than 5 times a week had a 34% lower risk of death from any cause, just from eating nuts. So you're probably asking, how does that even work? Well, the science behind it is actually pretty cool. It's like a little 3-step process. Step 1, you eat something like walnuts. Step 2, your body gets this thing called ellagic acid from them. And then step 3, certain bacteria in your gut take that and turn it into something even more powerful called urolithin A.
And this is where the story gets really compelling. That final compound, urolithin A, has shown so much promise that it's not just some theory anymore. It's now in a phase 1 clinical trial at, wait for it, Johns Hopkins. A top-tier institution is looking at this compound to see if it can actually improve outcomes for surgery patients. That's huge. Okay, so we've covered a lot of ground, from aspirin to coffee to walnuts. So what's the big takeaway here? What does this all mean for you? Really, it's about taking this kind of research and using it to feel more empowered on your own healthcare journey. So let's just do a quick recap. We've seen that aspirin might seriously reduce the risk of cancer coming back, especially in those tougher cases. We've learned that with coffee, it's not one size fits all. It really depends on your personal genetics. And we've seen how walnuts contain a compound that's so promising it's now in a clinical trial. Pretty amazing stuff. And all of this really leads to one final, really important question for you to think about. Armed with this kind of information, what's one new thing, one new question that you'll discuss with your doctor next time you see them?